Hello everyone, let's talk about zinc. Zinc is a pretty important micronutrient and there's a lot to talk about, so let's get started. In chemistry, zinc is the first element found in group 12b in the periodic table. It has some similar properties to magnesium, especially the oxidation state of 2+. So zinc 2+ is a strong Lewis acid, which means it's a great electron acceptor. And as we can see, as we will see, it is the 24th most abundant element in the Earth's crust, which accounts for about 0.01%. It is water soluble and therefore can be easily lost in cooking and processing food. It is also found in soil and in food. Especially in food, zinc is richly found in animal products, such as shellfish, and oyster has 10 times more zinc than any other food. Can be found also in beef, red meat, turkey, chicken, dairy products, eggs. Can also be found from plant sources, and so it's found in nuts and legumes such as soybeans, pine nuts, cashews, chickpeas, almonds, beans, and fortified grains. But again, animal sources are greater sources of zinc than plant sources. And in the US, 70% of the zinc comes from animal sources. Usually 12 to 59% is absorbed. So milks, eggs, fiber foods, bran, and phytates can inhibit zinc absorption. However, amino acids such as cysteine, methionine is found in animal products can improve zinc absorption, so which makes animal foods a better source. And other minerals can impact zinc absorption, as those that are listed on the screen. So, other than from food sources, zinc can also be obtained through supplementation. And the organically bound forms are usually best absorbed, and those are the acetates, citrates, gluconates, and those that are listed on the screen. They're usually better absorbed than the inorganic forms. So zinc supplementation is usually best taken between meals, but it is usually better tolerated with meals. And for the adults, the RDA is 11 milligrams for men, 9 milligrams for women. And if a deficiency is present, you can take a little more frequently, but be aware that excess can cause immune suppression, premature heartbeats, dizziness, drowsiness, increased sweating, muscular incoordination, alcohol intolerance, hallucinations, and even anemia. As we saw, there are a lot of interactions with other nutrients, so we must pay attention to it. So, for example, increase dose of zinc can interfere with magnesium and also with copper. Then taking non-heme iron can reduce zinc absorption. Tin and cadmium can inhibit zinc absorption. And so folate and zinc should be taken separately. Increased dose of vitamin B6 can reduce zinc absorption. That's especially important for HHD children. And zinc deficiency can also reduce release of vitamin A from the liver. And you also see some interactions between essential fatty acids and also N-acetylcysteine as well. So something to pay attention on, and it's very, very, very important. So the risk between deficiency and toxicity can be tricky with all these interactions. So let's take a closer look into toxicity and deficiency. So toxicity, as we'll see on the next screen, can be classified as acute and chronic toxicity. The acute toxicity can be experienced with symptoms of abdominal pain, cramps, diarrhea, nausea, vomiting, loss of appetite, headache, and even metallic taste in the mouth. Chronic toxicity results usually from copper deficiency and calcium. Results in copper deficiency and calcium deficiency. Other symptoms of chronic toxicity include gastric problems, and then problems with immune function, decreased high-density lipoprotein cholesterol, and accessing can be implied in the pathogenesis of Alzheimer and also in nutrient imbalance. Zinc deficiency is usually classified as a type 2 nutrient deficiency because it impairs growth. It makes the body conserve the nutrient, and its excretion falls to very low levels. And there are usually 5 general causes, the ones that are listed on the screen. So inadequate intake, increased requirements, malabsorption, increased losses, and impaired utilization. There are many factors to be aware and to consider, and some of those are diet, aging, pregnancy, growth periods, birth control pills, increased copper intake, fasting or starvation, serious illness, hospitalization, stress, burns, alcoholism, and a lot of other things. So the deficiencies can be classified into 2 different types. Regular deficiency, which could be seen in white spots on the nails, decreased sense of taste and smell, acne, heart thinning and loss, depression, irritability, and a few other ones. And the severe deficiency can be seen and can cause delay in cyst growth and development, delayed sexual maturation, skin rashes, severe diarrhea, decreased appetite, night blindness, and all the other ones. And the population that is usually at increased risk are infants, children, bottle-fed infants, pregnant and lactating women, people malnourished, adolescent, college women, older people, strict vegetarians, and all the other ones that are listed on the screen too. So those are the ones that need to pay attention at the increased risk of deficiency. As we can see, zinc is a pretty big deal in the body, and you will see that there's a little bit of a difference between how much you can find in females and males, but zinc is usually the second concentration to iron. Here's the list of where you can find zinc and where it's more present, but zinc it's usually more concentrated. It's also concentrated in the prostates and testes, which is very interesting. So, but zinc, most of the zinc, 95% of it is found as intracellular, 0.1% found in the plasma, 70% of it is bound to albumin, and 7 to 80% is cellular. So zinc absorption usually happens in the GI tract, with the highest absorption in the jejunum. Storage, there's no specific site, but cells have vesicles that are used as a transient source. In excretion, it happens to the intestine from the pancreas, but much of it is reabsorbed. And it's directly related to the intake of zinc. There's a low urinary excretion, but that may increase depending on certain conditions. And there are some other ways of excretion which is very minor, as those that are listed on the screen. Zinc has 3 major roles. Those are the catalytic role, which is associated with the being used for over 100 enzymes. There's a structural role that it takes part of proteins, and also of the structure and function of cell membranes. There's also a regulatory role as a transcription factor, important for cell signaling, immune system, hormone release, nerve impulses, and all of that. And you have a list of also more specific functions as well. It can be used for disease prevention, those that are listed on the screen, such as impaired growth and development, infectious diseases in children, impaired immune function. But it can also be used to treat diseases such as acne, alcoholism, anorexia nervosa, common cold, diabetes, HIV, infertility, pregnancy. And there are important drug interactions to be considered. Those that are listed on the screen with antibiotics, aspirin, anticonvulsants, diuretics, or contraceptive. And there are three major ways of testing for zinc. Those are the plasma zinc, the red blood cell zinc, and the serum metallothionein. And there are two other methods that are also considered as well. So I hope you enjoyed this presentation, which was a lot to take on this small time. There's a lot more to learn, but I hope this was informative to you. Thank you so much, and have a good day.